PCOS, or polycystic ovary syndrome, is not just one condition, it's a spectrum. And understanding the different types is what actually explains why symptoms vary so much from person to person. Inside the body, PCOS is not defined by cysts alone. In fact, many people with PCOS don't have cysts at all. The condition is driven by hormonal imbalance, metabolic dysfunction, and disrupted signaling between the brain and ovaries. To understand the types of PCOS, you have to start with what normally happens. The ovaries receive signals from the brain, specifically the hypothalamus and pituitary gland. These signals regulate ovulation. Each cycle, follicles begin to mature, one becomes dominant, and an egg is released. But in PCOS, that process is disrupted. Follicles may begin to develop, but they don't fully mature, ovulation may not occur, and hormones begin to shift out of balance. There are several patterns commonly described as types of PCOS. Not official diagnoses, but clinically useful ways to understand what's driving the condition. The first type is insulin-resistant PCOS. This is the most common. Here, the underlying issue is not just reproductive, it's metabolic. Cells become less responsive to insulin, so the body produces more of it. This is called hyperinsulinemia. High insulin levels stimulate the ovaries to produce more androgens, male-type hormones like testosterone. As androgen levels rise, ovulation becomes less likely. Follicles stall, cycles become irregular, and symptoms appear. These may include weight gain, difficulty losing weight, acne, excess hair growth, irregular or absent periods. Over time, insulin resistance also increases the risk of type 2 diabetes and cardiovascular disease. The second type is post-pill PCOS. This occurs after stopping hormonal birth control. Birth control suppresses natural hormone signaling. So when it's discontinued, the body may take time to reestablish balance. During this period, androgen levels can temporarily rise, ovulation may be delayed, and symptoms similar to PCOS can appear. Irregular cycles, acne, hair changes. But in some individuals, this imbalance persists longer and resembles a PCOS pattern. The key difference is that this type may resolve over time as hormone signaling normalizes. The third type is inflammatory PCOS. Here, chronic low-grade inflammation is the primary driver. Inflammation affects hormone signaling pathways. It disrupts ovulation and increases androgen production. Unlike insulin-resistant PCOS, this type may not always present with significant weight gain. But symptoms still occur. Irregular cycles, fatigue, skin changes, digestive issues. Inflammation can be triggered by chronic stress, poor diet, environmental factors, and underlying health conditions. And over time, it creates a hormonal environment that mimics PCOS. The fourth type is adrenal PCOS. This type is driven by stress hormones. Specifically, the adrenal glands produce excess androgens, particularly DHEA-S. Instead of the ovaries being the source, the adrenal system is overactive. Chronic stress plays a major role here. When cortisol pathways are dysregulated, the body may shift hormone production toward androgens. This can lead to acne, hair thinning, irregular cycles, but often without significant metabolic dysfunction. This type may be missed because insulin levels can appear normal. Across all types, one thing remains consistent. Ovulation is disrupted. And when ovulation is inconsistent, the hormonal cycle loses its balance. Estrogen may remain elevated without the normal rise and fall. Progesterone may stay low. And the body enters a state of hormonal instability. Diagnosis of PCOS does not depend on one test. It is based on a combination of findings. Irregular or absent ovulation, elevated androgen levels, polycystic appearing ovaries on imaging. But again, not all are required, and not all individuals present the same way. Treatment depends on the underlying driver. For insulin-resistant PCOS, improving insulin sensitivity is critical. For inflammatory types, reducing systemic inflammation becomes the focus. For adrenal-driven patterns, addressing stress and hormone regulation is key. And for post-pill cases, time and monitoring may be appropriate. But one of the most important things to understand about PCOS is this. It is not just a reproductive condition. It affects metabolism, hormones, and long-term health. And the earlier it's recognized, the better the outcomes. Symptoms are not random. They are signals that the body's systems are out of alignment. And in PCOS, those signals can look very different depending on the underlying cause. Understanding the type is what allows treatment to be targeted, and that's what leads to real improvement. Brought to you by Current Med Media. If you want to better understand what's happening inside your body, subscribe to the channel. New videos are released regularly to break down complex conditions in a way that's accurate and visual.